nursing student from Section WIEDENBACH. So for today's video, I'm going to perform Tepid sponge bath demonstration. So Tepid sponge bath is the application of cold water to the surface of the skin by the means of wet sponge. Prepare the water to a temperature of about 29.5 degrees Celsius or 85 degrees Fahrenheit and add ice chips to bring the temperature down while bathing the patient until the water temperature reaches for about 18 degrees Celsius or 64.4 degrees Fahrenheit. So for this is our water source, and we have to put pour the water in the basin. And then this is our small basin with the ice chips. Good morning, Miss. I am the nurse for today, and my name is Garcia. Can I ask what's your name, please? And your date of birth?
March 28, 2001.
Okay. So next, we have to prepare the client to gain cooperation and to allay anxiety. So for today, Miss, I'm going to perform the Tepid sponge bath procedure. And with sponging your face, your neck, your leg, and your back will cook for about 25 to 30 minutes. So next, we have to protect the patient's bed with moisture waterproof material to protect the patient's linens from getting wet. So our waterproof material. Next, we have to remove the gown of the patient and assist the patient to a comfortable supine position. So removing the gown provides access to the surface of the skin. Top sheet with bath blanket to protect the linen of the patient from getting wet. So this is the bath blanket. Prevent chilling, minimal exposure, and provide privacy to the patient. Next, we have to place the bath towel under the head of the patient to prevent the bed from or the linens of the patient from getting wet. Next, we have to prepare several ice bags. Once the ice bag is placed at the head of the patient, this is to promote comfort, and ice bags helps to cool the patients further. So other are placed on the axillary areas and on the groin where the blood vessels are close to the skin surface. Since the axilla and groin contains the large superficial vessels that could aid to transfer of heat. And the application of ice bag promotes cooler temperature to the core of the body by conduction. Washcloth is to be used for the axilla and groin. We need to have 4 washcloths, and then we'll put it into the water. And then we have to fold it into 4 parts. Then ring them so that it will be damp and not dripping. And then put this on the axilla of the patient. In doing this, we should always remember that washed clothes need to be moist as possible in order to be effective. Leave washed clothes in place for about 5 minutes or until they feel warm. And then we have to repeat or re-wet the washed clothes and replace them as required during bathing. Since washed clothes warm up quickly in the vascular areas of the body. After that, we have to immerse washed clothes in the basin with water for sponging. So after that, sponge the face of the gland with plain water. We have to pat it until dry. So always remember to do it from the inner canthus to the outer canthus. After that, we have to sponge the neck of the patient, and it will take for about 3 to 5 minutes. And always remember not to rub the skin of the patient, since friction may raise the body temperature of the patient. So after that, we have to place the bath towel under the one arm of the patient to sponge the other arm. So always remember to sponge the farther arm first. Farther arm first. Okay, just pat it in order to prevent friction, since friction may raise the body temperature of the patient. Sponging the patient in this direction to promote venous blood circulation. And then the other arm. So this sponging may take for about 3 to 5 minutes or as long as client can tolerate. So full sponges should be given rapidly or for a short period of time, tend to increase the body's heat production mechanism by causing shivering to the patient. So after that, we have to cover but do not dry each part as it's sponged. Since evaporation of moisture in the skin helps to reduce body temperature, and excessively heavy covering may increase body temperature. So after that, we have to sponge the lower extremities. Just like what we do earlier, and then hold briefly the wrist and the ankles, since blood circulation is close to the skin of the wrist and the ankles. So just sponge the farthest. And then, hold the ankles briefly. And after that, just repeat it on the other side, on the other leg of the patient. Change water as needed, since water temperature rises due to the exposure to the patient's warm body surface. The back portion of the patient's body is to be sponged with for about 10 minutes, and commonly the anterior chest and abdomen are not usually sponged since there is no large superficial vessels in this area. Check the patient's skin and pulse rate. So if the patient's skin becomes cyanotic or pale, and or if the pulse rate of the patients are irregular, discontinue the procedure immediately. Since it only indicates that the body temperature of the patient may have dropped into subnormal level. After that, we have to do the aftercare of equipment and change the bed linens if needed in order to avoid transmission of infection. To check the patient's temperature for about 30 minutes after the bath to ensure that the procedure is effective. Document assessment, including the temperature checks. The drop temperature should be recorded also. Graph according to agency policy. Since recording communicates the care provided in accurate and firm fashion. So that's the coverage of our Tepid sponge bath demonstration. Again, this is Mary Rose Garcia, a second-year nursing student from Section 1 in BSNII. Thank you and God bless us all.